Throughout its 95-year history, Regional West has been on the leading edge of healthcare services. It was the first hospital in the region to offer polio care, hip replacement surgery, dialysis, bariatric surgery, air ambulance service, and much more. The community's generosity and willingness to invest in new services and technology allowed the medical center to become a regional referral center, offering an exceptional scope of services so patients can receive the care they need close to home. Once again, Regional West has the opportunity to offer the leading edge of healthcare technology by investing in robotic surgery.
Well, historically, all surgeries were done with what we call open incisions. A scalpel, a long incision. If it's in the abdomen, you open the abdomen up, you have retractors to hold that space open, and everything was done manually. Then laparoscopic surgery, the first take on minimally invasive surgery, came along. Now we're using cameras inside of the abdomen, and the optics of the camera allow magnification. It allowed for minimally invasive incisions for the patients. It's usually less time in the hospital. It's less painful because you don't have those long incisions. The recovery time is much better. Now with the robot, it's exponentially better. The optics, the magnification, and the vision you see when you're using the robot is unbelievable, actually.
When I finished residency 10 years ago, UNMC had one of the earliest Da Vinci systems, and I was able to do numerous surgeries with that prior to graduation from residency. It's an excellent tool for gynecological surgery. In fact, some of the advantages would include the fine suturing and dissection that you're able to do more so than with regular laparoscopy. The Da Vinci system allows us to have depth perception, which allows us to be finer with our suturing and finer with our dissection, and more of a natural movement with our wrist as we do the surgery. Because of the fine dissection with the Da Vinci, you're able to preserve normal ovarian tissue when you're taking a cyst off of an ovary. This allows us to dissect the ovary completely away, then sew it back together. The same thing can be done with fibroids, which are large tumors on a uterus, which preserves the uterine tissue but takes the fibroid away. This would preserve a woman's ability to have a baby after surgery.
It's totally a different concept. So the patient's in the room and then the robot's up against the patient, and you actually have your scrub nurses or your scrub assistants set the robot up. The surgeon or surgeons, if there's two of them, sit at a console across the room. The ergonomics are much easier to set at a console. You don't get fatigued a long operative day.
I just recently graduated from residency in Columbus, Ohio. During that experience, found that the robot really shined in dealing with the parts of the abdomen that are much harder to reach, such as the upper abdominal cavity, the upper stomach, and the lower esophageal area, but also in the deep pelvis areas. Advantage of the robot is that it combines the best of both worlds of laparoscopic surgery and open surgery. It uses the small incisions of laparoscopic surgery, but then you have the control and precision, three-dimensional visualization, and wristed movements that you have with open surgery. Robotic technology also has been shown to have better outcomes. Urologic and gynecologic surgery and thoracic surgery are some of the other areas where the robot really shines.
As a regional referral center, local and regional patients depend on us for exceptional care. They're grateful that we offer cardiac catheterization, neurosurgery, cancer treatment, interventional radiology, and other specialized areas so that they don't have to travel far to get their care. But they also expect us to have the latest technology and top quality providers. Our ability to continue to recruit skilled providers and talented surgeons depends on our continual investment in this medical center. Surgeons are now certified in robotics when they complete their residencies. To recruit them to our community, we must offer them the tools that they need to continue to take care of us, our friends, and our families now and into the future.
Robotic surgery won't replace laparoscopic or open surgery, but it certainly serves as another valuable tool that the surgeon can use to serve the patient. In certain patient populations, it is going to be the right way to do surgery, while there is still going to be room for laparoscopic and open procedures.
Our plan is to develop a single robotic surgery suite that will be used by surgeons from different services, including general surgery, OBGYN surgery, urology, and others as they become certified. This is an important next step as we continue to offer exceptional care for this region.